Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today is the first of a two-part series on natural healthcare that I am pleased to. I've never been so excited about a show that we've put on. And I have a guest here that will be with us for the next two shows. Her name is Elizabeth Bewley, and she has written a book called Killer Cure: Why America's Healthcare System is the Second Leading Cause of Death in America, and How to Make It Not Yours. Elizabeth Bewley is a retired executive who worked for Johnson & Johnson for 20 years. She is a graduate of Columbia with an MBA and has adjunctive training. She's the founder since 2008 of the Perio Health Institute. She's lectured at national health conferences throughout the country and is an advocate for patients' rights and the rights of the individual to lead a long, healthy, and productive life, and to have a better understanding of the healthcare system, how to make it work for themselves. And I'm just so excited about this book that I want everyone out there to read. And with no further ado, I'd like to introduce you to Elizabeth Bewley. Elizabeth, welcome on the show.
I'm delighted to be here.
It's a pleasure to have you here. Now, in working along with the title of your book, why is our healthcare system the second leading cause of death?
Side effects and complications of treatment kill more than 600,000 people every year. These side effects and complications involve infections, blood clots, and mistakes in hospital care, and consequences of taking medicines that aren't the ones that are intended consequences. So that's like killing the entire population of the city of Boston every year. Said another way, when your doctor gallops in on his powerful stallion to save the day, sometimes you get run over by his horse.
Now, I was reading earlier on in your book, you relate some of your earlier experiences with injuries as a teen that helped to formulate or start this whole process of thought. What was that about?
Well, when I was 15, I was rushed to the hospital because I almost stopped breathing. My throat was nearly swollen shut. They confined me to bed. They told me not to try to whisper. I couldn't talk at all. And they set up a surgical kit next to my bed. They told me to press the call button if my breathing got any worse, because to save my life, they would have to operate on me right there to cut an emergency airway into my throat. So a few hours later, I pressed the call button for the first time, and they had told me someone would come running. Nothing happened. Nobody came. Instead, after a moment, a voice came over the intercom saying, "What do you need?" Well, of course, I couldn't talk because of the swelling in my throat. And a minute later, the voice said, "If you don't say what you need, no one will come." And I froze, and I realized that I could die right then in the hospital with the surgical tools to save my life, lying less than 2 feet away. So as Cool Hand Luke said, what we've got here is a failure to communicate. And that was my first hint that the promise of healthcare to save lives can fall apart. You know, if you had to guess what was going on in the mind of the person on the other end of that intercom, here are two possible choices. One, you might think it would be, this is a hospital. The children on this floor are very sick. If someone presses the call button and then doesn't say anything, I better check to see if something's really wrong. But a second alternative is, if a child presses the call button and then doesn't answer me when I speak to her, she must be fooling around. just trying to make my job more difficult. I'll make it clear to her that we'll interact with her on our terms, not hers. So if you had to guess which of those is what was going on, it's clear that it's the second one. And that reflects an assumption in healthcare that's fairly common, which is if the patient does something that's unexpected, it's because they're trying to be disruptive. They're trying to cause a problem.
And what are your further observations in the formulation of within healthcare of where things go wrong?
Well, there are a lot of hidden assumptions that come into play on the part of doctors and nurses and other people in healthcare that harm patients all the time. And it's not intentional. People who work in healthcare want to do a good job, but they get tripped up by their own assumptions. So, for example, one of these is everything I do will work well. All of the care I provide will work. So that's like a professional golfer who never looks to see where his ball lands because he assumes that he gets a hole in one with every time he swings his club. It's not realistic. But because people in healthcare tend to think everything will go well, they're not so much on the lookout to prevent side effects and complications or catch them early when they show up to prevent these deaths and additional injuries.
I have similar things that I witness in clinical practice regularly. It's, I have no problem with people, being on medication and needing medication, and frequently that's just what's indicated. But a lot of my older patients come in with lists of medications that they're taking, and some of them are taking, 8, 10, 12 different forms of pharmaceutical medication. Now, on an individual basis, each and every one of those can be clinically indicated for that patient. But when I look at the second half of the list, they're really just remediating the side effects from the other medications. And this duplication effect, it's so much of a strain on their system. And there's a lack of an intercommunication within their treating physicians that, many times when we bring these forces together and those patients, they say they lop off, a certain amounts of medication, the patient starts to rally and get better and feel better and isn't lethargic, and we're not treating yet again another side effect and things like that.
Yes, you're completely correct. The typical drug helps only about half the people who get it, and side effects are very, very common. For example, more than 50 drugs can result in significant weight gain for a lot of the people who take them. And that weight gain can be as much as 70 pounds in the first year that somebody is on a medication.
Yeah.
So then by the time you add 2, 3, 5, 10 drugs together, it's almost inevitable that people will experience side effects. In fact, one group of researchers concluded that the fastest way to solving health problems among the elderly, which they defined as age 65 and older, was to assume that every symptom they have is a side effect of a drug until proven otherwise.
That's really interesting because my grandmother died a few years ago, and she was just a few days shy of 100 years old. And she was never on any medication at all. And her generation, the goal was to not be on medication. It's not that you didn't take it if you needed it, but the goal to be healthy was to not be on medication. It seems nowadays we've been conditioned by society by advertising and just some context of modern medicine in which you need medicine to stay healthy, and it's kind of spooky. I'm not saying it's a bad thing, because when people need medicine, they need medicine, but the concept of embracing it versus stepping back and seeing whether it can be remediated in other ways is kind of scary.
I call this the Santa Claus assumption. Any 7-year-old who celebrates Christmas If you asked him, is it better to get more or less from Santa Claus? There's only one answer to that question. More is always better. And people treat the healthcare system, doctors and hospitals, the same way, as if they're Santa Claus, as if the more stuff you can get, the better it is.
Yeah.
The more drugs, the more treatments. And a better model, a better way to think about healthcare would be Goldilocks. So one bowl of porridge was too hot, one was too cold, one was just right. Too much healthcare can kill you. Too little healthcare can kill you. What you need is what's
just that
right.
Yes. Divide.
Yeah.
I think you're absolutely correct. You know, it might be even a reflection of a bigger thing within our society of more is better, more money is better, a bigger house is better, more material items. More means more happiness. Like having abundance is you're going to buy your happiness. And just like we frequently hear, you can't buy your health when it's gone, even though you have all those resources. Part of what you're saying may be a transposition of our societal value system of supersize me. You know, give me the value meal. Give me the biggest. You know, the more is better. And this is obviously an example of which it's not.
Yes, you're completely correct.
As far as changes within our fundamental healthcare delivery system, what are some observations that are most outstanding in your mind?
If you observe the healthcare system and you didn't ask anybody what its purpose was, but if you just observed it, you might conclude that the purpose of healthcare in the U.S. is to deliver tests and treatments, because it does that a tremendous amount of the time. There are 119 million visits to the emergency room. The average person sees the doctor about 4 times a year. There are 15 prescriptions every year for every man, woman, and child in this country. Yes, 15 prescriptions written, yes.
Somebody's having mine. But that's a lot.
So there's a lot of care being delivered. And I would suggest that a better purpose for healthcare would be to enable people to lead the lives they want. So as an example, I once went to a foot surgeon. I was having some pain. And he immediately told me that I needed to have surgery to treat bunions. So I have these bony protrusions around the ball of my foot, and he told me I should have surgery. Well, that's serious surgery. It can take 6 months to recover, and it can set the stage for some other problems later because you're messing around with the bones in the foot and the joints. But if my idea about healthcare was every abnormality should be treated, then I would certainly have gone ahead and had the surgery. But if I had the idea that healthcare should be about enabling me to lead the life I want, do the things I want to do, then I'd have to ask, so what can't I do as a result of having bunions? I can hike, I can ride a bike, I can swim, I can sleep, I can walk, I can do all of these things. The only thing I can't do is wear, 6-inch heels with, really narrow toes. But I don't need to do that in my life anyway.
Yeah.
So if you match what your life is to what you're asking of healthcare, you'll do much better. So I would be better off, and I did, by saying, no, that's okay. I don't need that surgery. I don't need to fix that problem because it doesn't interfere with my life. But there are a lot of people who think anything that's a little deviation from normal requires a big intervention, often surgery, and it doesn't help them lead the lives that they want.
Well, it kind of gets off track a little bit with what you're talking about, but in looking at the huge increase in cosmetic surgery, just on a superficial basis of, meeting one's psychological makeup to make themselves perfect or more right or more better. The complaint that I get from medical doctors that are friends of mine a lot is that many times a person will come in with the mindset that they they feel upset if they didn't go and walk out with a prescription for something. That they went to the doctor and the doctor didn't do anything for them because they didn't get a prescription.
Right.
And so that wasn't even a doctor-driven thing. That's
Right.
their counterbalance to say, hey, listen, I reassured you that you're going to be okay.
Right.
That you don't need it.
Right.
But because they didn't get something,
Right.
it was like, it was like you got coal for Christmas instead
Exactly
of,
right. That's right.
instead of the present.
Yes.
So,
That's right.
whereas that could have been a healthy step for them,
Yes.
that was unhealthy.
Yes.
I think part of the difficulties that some of the medical doctors have with some of the managed care now is that the volume of patients that they have to treat is so great that they can't spend the time to teach them even some of the lifestyle steps that they might need to do to remediate their problem doing natural means and things like that.
One of the things that it would be helpful for people to understand is that there are often other practitioners who can help a great deal: nurse practitioners, physicians, assistants, dietitians. There are a lot of people with a lot of expertise who are very good at communicating, who can help people understand changes that they need to make that the doctor may not have time to explain to them.
Yeah. Well, I think it's one aspect that can be enhanced by, let's say, group practices where you can they can have enough resources to hire people to work with them in that manner to educate and teach people. I know that Somerset Medical Center, which is right behind my office, has like an outreach program with SAIL where they educate some of the older people on exercise and nutrition and how to eat right, because it seems like with the elderly, they get to the point where they number one, they don't want to cook for one, let's say, even though it would behoove them to cook for one.
Right.
So, or if a spouse passes on and they don't feel inclined to do that anymore, their health care starts to deteriorate. But it's just a funny side story. My aunt and uncle lived their lives, and they did whatever they wanted. It was my uncle smoked 4 packs of Lucky Strikes a day, and I didn't see him ever take any nutrition in other than soup and beer. So, but he died recently. He was diagnosed with lung cancer 30 years prior, and he didn't take any treatment at all. And not that I recommend that for anybody. Right. That's not the point. But he was just so stubborn that he said, "I'm not going to do that, and I'm not going to. I'm not about to do that." And he lived for another 30 years. But that's a counterproductive story. That's like, my aunt drank a quart of Jack Daniels every day and lived to, but that's not the usual. But my aunt, they lived in Maine and they would vacation down in Florida for the summer. My aunt broke her hip, right? And he was convinced that they didn't have good doctors in Florida. So he was going to bring her back. It took him 10 days to drive her back up to Maine from Florida, and they would stay in a hotel. And those carts that you push the luggage in with the big brass thing. He'd be pushing her into the room.
Wow.
from their mindset of that. But he had passed on. But she went into an assisted living facility, and her basic nutritional status and healthcare needs were being met where they weren't before.
Right.
And it's like, I have my aunt back.
Yes.
And it's amazing how simple things can be prolonging things, or health, the basic health quotients, stuff like that.
Yes. And to the point of your uncle, maybe a slightly different approach I would recommend for most people would be to ask questions about treatment options. So not simply to say no to all treatments and not simply to say yes, but to ask a lot of questions. For example, one question is, how many people out of 100 are helped by this treatment? Because that would give you a pretty good idea. A lot of people think, well, everybody who gets this treatment must be helped by it. But that's really not true at all. If people are prescribed a drug, a question they can ask is, how will we know if this is working for me? And when will we know if this is working for me? Because some people are prescribed drugs for chronic conditions that they take for 5 or 10 years without anybody ever asking whether it's doing more good than harm.
Yeah, I usually, when patients come in and they have concerns about medications that they've been given, but that they're really like short-term courses or regimes of treatment. I usually try to console them that that's fine, because usually there's a beginning, middle, and an end to that, whether that be an antibiotic pack or a steroid pack or something. I mean, there's a regime. It's done. It's over. It's complete. You're done with that.
Right.
It's the patients that are on these longer-term medications, whether it be a Lipitor having frequently a side effect of muscle spasms and back things, and we get the patient off the medication and their back condition resolves. So I mean, it's those long-term use. It seems like the longer you take something, the more probability, or more possible and probable of long-term consequence
and
of that.
The more important it is to ask questions to make sure that you know how it's going to be determined, whether it's really doing more good than harm. Yeah.
Well, do you feel that some people shy away from their line of questioning because they don't want to come off as if they're questioning the doctor or questioning his ability? Yes,
certainly people do feel that way. But by way of analogy, some people feel, well, the doctor is the expert. I don't know. I'm not trained medically, so how could I know whether what he's telling me is right or not? I have to trust the doctor. But by way of analogy, I would say, if you wanted to buy a new car, would you let the car dealer tell you what car you're going to buy and what car you're going to drive for the next 3 years? Well, the car dealer is an expert in cars, probably knows a lot more than most people do about cars. But you're the one who knows how that car is supposed to support your life. Do you need a pickup truck for all your fishing gear, or do you need a sports car because you have something else in mind? And it's the same with health care. The doctors are the experts in different treatments, and sometimes you need them. If you need brain surgery, you're going to need a doctor. You're going to need an expert. But you are the expert in your own life, so you need to be clear about what you need so that you can make sure that you get the right treatment that will enable you to lead the life you want.
I feel that modern medicine and modern medical care has done such a great job in acute intervention for emergent, if you're in the right place, acutely dealing with immediate medical emergencies. That's almost where the stellar accomplishments are in medicine at large.
Yes, you're completely right, and there are historical reasons for that. It used to be in the era of, let's say, Marcus Welby, MD, or even a little earlier, if somebody had pneumonia and you gave them a shot of penicillin, that's the difference between life and death. So the whole healthcare profession grew up with the idea that you give somebody a treatment, you save your life. That's what healthcare is. But today, 70% of people die from chronic diseases like diabetes or heart disease. And it's not the same equation anymore. Marcus Welby can't make you better. He's not there to snatch the potato chips off your lunch tray or drag you off the couch after dinner to go for a walk instead of watching old Law and Order reruns. The person who has to take the action is you. So the healthcare has kind of a mismatch. It's these acute interventions, doctors doing dramatic things, being applied to chronic conditions, and that doesn't work. Applying acute interventions to chronic conditions.
Right. I find that so much now, and with my observation is that when I first started in practice, people used to come in to me to have them treated for stress and stress-related conditions. And then I found that a proportional decrease in that population of what came to see me. And I couldn't understand why was that when people were under more stress and duress than ever. And then what I witnessed was a correlation between the amount of patients coming in for insomnia was increasing. And what I then realized was that it used to be that people that were under stress and could at least have consolation by going to bed. Now they took their stress to bed with them, and they're all on Lunesta and Ambient, and now we have a population of insomniacs. What I'd like to do next, Elizabeth, and what we're going to do with you on our next show is that we're going to pick up on lifestyle and changes that you as a patient can make to make your life more fulfilled. Elizabeth, thank you very much for joining us on the show today.
Happy to be here.
And I'm going to see you on the next episode. Thank you for watching. I'm Dr. James R. Golding, and you're watching A Natural Healthcare Alternative.